This week with Module 5, we're entering with a new group of modalities under the heading of ultrasound. Um, there are 4 general ways that you can apply ultrasound: direct technique, indirect with the bladder or gel pad, the immersion technique underwater, and then phonophoresis where we use a medicated medium. So again, most of the information is in the book, and I guide you along with the study guide. There are a few things that I wanted to point out though this week under ultrasound. So the first one under how does it work, there's 3 main words that I want you to make sure that you understand. One is piezoelectric effect, which actually I want you to understand the reverse piezoelectric effect. But starting with the piezoelectric effect, we have a synthetic crystal that is in the sound head that hopefully you've read about already. And when you deform it with compression or decompression, it creates an electrical voltage. However, there is something called the reverse piezoelectric effect, and it takes electrical energy and it causes a deformation of crystals, and then sound energy is produced. So it's the piezoelectric effect just in reverse. So that's what's taking place with ultrasound. You plug the machine in, electric current comes through that causes these crystals to expand and contract or deform, and then sound energy is produced. So here's another picture of it. Here's the crystal or the alternating current, and then the crystal contracts and expands based on where the current is at. And that affects the molecules, whether they're compressing or decompressing. So the reverse piezoelectric effect causes collision of molecules to take place in the body, which results in then 3 things. One is tissue regeneration, wound healing, and then cell membrane alterations. And this really right here, the cell membrane alterations, is where we're going to see a big difference in using ultrasound versus not using ultrasound. The 2 other words or concepts that I want you to understand are stable cavitation and acoustical streaming. Stable cavitation is when sound waves' ability to produce expansion and contraction of microscopic gas-filled bubbles within the human tissue. And then this expansion and contraction of these bubbles alters the cell function, promotes healing, and that's again where we see the non-thermal effects of ultrasound is with stable cavitation. The other one is acoustical streaming, and this is when the sound waves produce expansion and contraction of the gas-filled bubbles in human tissues, but it causes because of that expansion contraction, it causes a unilateral flow of fluid around the cell membrane, which alters the cell function. So that's a little bit in the book, but just some pictures hopefully to help seal it into your memory. When we talk about non-thermal effects of ultrasound, I want to clarify that anytime you turn the machine on, you're going to get non-thermal effects of ultrasound. So changing the cell membrane, the acoustical streaming, and the stable cavitation. So whether you add heat or not. We can get non-thermal effects or non-thermal ultrasound with these settings. One is pulsed wave ultrasound at 20% pulse, 0.5 watts per centimeter squared for 5 minutes. And you should memorize this. If you're going to start using pulsed wave ultrasound with a patient, you would start with these parameters. Or if you have a machine that does not allow you to establish a pulsed wave at 20%, you can use a continuous wave, which is 100%, and you drop the intensity down to 0.1 watts per centimeter squared for 5 minutes, and that'll give you the same general output. The heat just won't accumulate. It just doesn't have a high enough intensity. A brief note on BNR, non-uniformity ratio. Again, it can cause hot spots. So what we'd like is a flat line all the way across here and not areas where it's spiking and we have a big intensity of ultrasound here. We would want it. B is a better picture, although ideal would be is if that line was clear across and it was the same intensity throughout the whole ultrasound head. Now, what if somebody complains of pain when you're giving the ultrasound, which should not happen, but if it does, what are some things that you could do? You could move the ultrasound head faster so this hot spot isn't directly at one point. That's one option. You can decrease the intensity. If you do that, though, you need to make sure that you increase the time of the treatment. You could move the ultrasound off of a bony prominence area, so maybe you're close to a bone and that sound wave is resonating off of the bone, and that can become painful, so just move the ERA over so that you're not on bony tissue. And then the last thing is probably wise that you get the machine checked and recalibrated if people are complaining of pain during an ultrasound. And then the last note is there is something called a stretch window. When we're using continuous wave ultrasound in order to increase elasticity of tissues, we only have about a 5-minute window after we turn the ultrasound off where the tissues stay heated and we can get some better stretch. And that's called our stretch window. So it would be wise that when you're doing ultrasound to increase range of motion or extensibility of a tissue, that you start stretching while you're ultrasounding. So let's say your ultrasound is going to last 5 minutes, and then you can add on about 5 other minutes, knowing that that's your stretch window. So if you start the stretch at the beginning of the ultrasound, you have a total of 10 minutes of stretch that would be effective rather than waiting until the ultrasound is over and then you only have 5 minutes. So little note on stretching window and how to properly utilize it. And that's all I have to add in for ultrasound. Hopefully that between that and the book, you're able to complete the study guide. Thanks.